It all starts when the allergens and dust particles enters the respiratory tract. Asthma. It is an obstructive lung disease characterized by difficult breathing with wheezing due to spastic contraction of smooth muscles in the bronchioles, which partially occludes the bronchioles and causes extremely difficult breathing. To make it obvious, let's hop into activities of two guys. It was a fine day. Two guys started their trip towards a forest. As they were depleted of energy, they thought of to rest in a place for a while, and have food and drinks. Before eating, they saw a group of cockroaches. They just pushed them off, and started to eat and relax. After some time, on their return to their home, they got stuck by heavy traffic, which caused more smoke pollution. Finally, they have reached home, and they looked so tired. So, they called it a night. The next day, they started normally. They had some cough and sneeze while eating, but they didn't care much about it. Two friends mistook those symptoms as cold. So, they just had cough syrup and called it a night. But they can't able to sleep, because of difficulty in breathing. Causes are, inflammation of air passage, hypersensitivity of nerve endings, pulmonary edema, and congestion of lungs. Problems continued for days, so they decided to go to hospital. Doctor diagnosed them and prescribed some medications, and also to take a test. Asthma can diagnosed by spirometry, peak flow, and also by allergic test. There will be a reduction in tidal volume, vital capacity, forced expiratory volume in 1 second, alveolar ventilation, partial pressure of oxygen. Carbon dioxide accumulates, resulting in acidosis, dyspnea and cyanosis. Indicators are, leukotrienes, are released from eosinophils and mast cells. After taking test as prescribed, the doctor checked their results, and said that they have asthma. After that, the doctor asked them about the places they have encountered. Then they said about the trip which they have seen a group of cockroaches, and also about the heavy traffic. After hearing all, the doctor said them that these are the causes of their disease.
Wait a minute! Who are you?
Cockroaches may sound as the most irritating. Cockroaches aren't just unsightly pests, crawling all around your kitchen in the middle of the night. They can trigger allergy as well. The saliva, feces and shredding body parts can trigger both asthma and allergies. Inhalers are the most common medication taken by the patients. It will relieve the symptoms when they occur, and also stops them from developing. Using inhalers alone will not help the patients to relieve. They also need to take medications. Those medications are LTRAs, which are the main tablets used. Theophylline may also be recommended if other treatments won't work well. And also, steroid tablets may be recommended if above medications don't work. This may be given as an immediate treatment, or long-term treatment, to prevent the symptoms. Coming back to the story, they returned from the hospital. After dinner, they took their medication which is an inhaler and, in that night, they slept without any disruption. After a long time, they decided to go out for lunch. They went to a hotel and started to eat. After a moment, one of the friend was struggling to breathe and fell down on the ground. His friend was shocked and he called an ambulance, and took him to the hospital. Ambulance has arrived to the hospital, and the doctor questioned his conditions and took the patient immediately to the ICU ward. To check his medications, his friend ran to the house. A procedure called bronchial thermoplasty may be offered as a treatment for severe asthma. It works well, and there are no serious concerns about its safety. Patients may be sedated by general anesthesia during surgery. This procedure involves passing a thin flexible tube down the throat and into the lungs. Heat is then used on the muscles around the airways to stop them from narrowing. He found that his friend didn't take his medications carefully. Doctors tried their best, but he dies.